It's such an honor to get to talk about Senator Henry, one of my favorite legislators and champions ever. And she's a person who really influenced me as a leader because of her advocacy for people without voices. She really has been just such a tremendous advocate for women and minority individuals in our state, individuals using IV drugs. I mean, she really has been a voice for people that often don't bring their voice to the policy table. And I remember the first time I met her, she had invited me to have lunch with her. And she asked me, what our plans are. She knew this was early in the Markell administration, and she knew that we were making changes, that we were cutting back on staff and cutting back on some of our services. And she said something so important to me, which is make sure you listen to what the community needs. Make sure you hear from the community about what is best for them. Yeah, I mean, one of the key things she did was ensure that we have an Office of Minority Health in the Division of Public Health, which is so important, that we're really designating a point place in our division where we're really focusing on minority health issues. But more broadly, she was really tuned into health issues, health disparities as it relates to our minority population, especially our Black and Brown populations in our state, and advocated in many ways to ensure that our minority populations have access to services. Cancer is one of the areas that I think about a lot, and advocacy for cancer screenings. Breast cancer is one of those areas, and wearing pink in honor of her today, being engaged with her in multiple breast cancer advocacy efforts. She really advocated for access to breast cancer screenings for minority women, especially. And during her time of leadership, Delaware became the #2 state in the nation for breast cancer screening. And even now, Black women in Delaware have higher rates of mammograms than white women in Delaware. So those efforts have really made a difference and saved lives. Yeah, I mean, she also advocated for and ensured that we have an Office of Women's Health in our state. And although across the Division of Public Health, we have a lot of efforts focused on maternal and child health and women's health services. The Office of Women's Health has become a coordinating office, and we are especially focused on domestic violence, which is a public health crisis. And through the efforts of Senator Henry and the Coalition Against Domestic Violence and our Office on Women's Health, we're really making great strides in our state in addressing domestic violence prevention, identification, ensuring women have services. And so, we owe a lot to her for really advocating for women, and especially some of these more challenging issues. Yeah, oh my gosh. I was not there when the initial legislation passed, but I heard stories. And, I think these stories really speak to her courage as an individual who was willing to be bold and really willing to take criticism for people who did not understand why there is value in a syringe services program. And through not only getting the legislation passed, but she remained involved. So when I began my role in 2009, she was still very involved in the at that point it was called the Needle Exchange Program task force. And it was really, it started as such a great program for us that people really saw the value pretty quickly. Not just a program where people came to get, new syringes, but a program where people began to trust, those individuals that were helping them have clean syringes, and they would get screened for HIV, and they would get screened for hepatitis, and they would talk to Brandywine Counseling, who's been running the program since the inception, about treatment options. And thousands of people through this program since the beginning have been referred to treatment services because they trust the partner. Shortly after I began, and we certainly recognized that it was limited to Wilmington per the legislation, and that was really because everywhere else in the state initially, did not want this in their backyard. It got expanded legislatively in 2014, which she, spearheaded those efforts so successfully. And now I'm sure she's very proud of the fact that we have over 30 sites across the state. And in comparison to, many other states, Delaware was a front runner, and we have not seen increases in HIV in IV drug users during this crisis, where so many states have had serious HIV outbreaks. We owe it all to the needle exchange or the syringe services program that we haven't seen an increase in HIV, that we haven't seen a more significant increase in hepatitis. But we also have gotten so many people connected to treatment through this program. So I feel we owe her so much for her leadership and her courage for getting this passed and getting Delawareans comfortable with harm reduction.
It's fitting, I think, to honor Senator Henry with a bridge, because a bridge for me is two things. It's a welcoming structure, and it's a connector. And I think those are two qualities that have been a very important part of your service to our state.
Yeah, I miss Senator Henry. We miss you in Legislative Hall, Senator Henry. I think you always brought your authentic and true self to every issue, and really advocated for people in our state, and you made our state a healthier and a better place. And just so grateful. I'm among the many Senator Henry fans who are grateful for your leadership in our state.